Kinesiology 3500, Drugs and Athletics, Classes 8 and 9 on gene doping and ergogenic aids. As we look at gene doping in Chapter 12 of our text, Drugs and Sport by Mottram, it is altering the athlete's DNA by increasing amino acids in anaerobic athletes and increasing mitochondrial activity in aerobic athletes. Some of the effects are unknown and some consider safer than the human growth hormone. It is illegal and perhaps could create, who knows, a super athlete, and it is hard to detect, but it is the future. In terms of gene manipulation, we can see that there are non-therapeutic uses of cells, genes, and genetic elements or modulation of gene expression having the capacity to improve athletic performance, as described by the World Anti-Doping Agency. On the right is the Belgian Blue Bull, which we're going to see a brief film about, and we see here even done with animals and experimentation. But yet with humans, it's going to be, the stakes are obviously much higher, and the risks can be much greater.
He's a big fellow. Am I all right?
He's quite big, huh? He's 160 meter tall, yeah.
If I saw a man like that,
yeah,
but I wouldn't get this close to him, I don't think. I would think he was on steroids or something. I think he was a bodybuilder.
It is 100% natural, whereby, let's say, within so many generations, all breeders have taken the best of the best, or the more muscle of the more muscle. We moved from a normal classical type of animal, and then we select that sort of animal based on the double muscle.
And when you say double muscle,
yeah,
do you mean it has two of every muscle?
No.
Because it looks like it does.
Absolutely.
It
has exactly the same type of muscle than any other breed, except that in terms of quantity, each of these muscles is by far more developed.
Right. This cow is technically known as a Belgian Blue, and it's the product of selective breeding.
Selective breeding is the first stop on our tour of how man is using science to control nature. It's used by farmers to enhance desirable characteristics in their animals. In fact, selective breeding is all about managing sex. To create these Belgian Blues, over 100 years, farmers have only allowed the cows and bulls with the greatest muscle mass to mate. And the result is a bull that weighs over a ton. The animal's breeders are keen to show off the results of their hard work. The bulls are shaved to best display their muscles.
What they try to do is to clip the animals in order to highlight all the muscle. You see?
Well, so you can see where all the meat is.
Exactly.
But even here, where they've sort of trimmed in there.
Yeah, to highlight that muscle, which has got a high value. You see?
And these are all going to be lean cuts, and they're all for quick cooking, are they?
Yeah, that's right. That's right.
Because when you look at this, you can't help thinking of lunch, you know? Is it healthy?
The animal, you mean?
Yeah.
Well, the animal is as healthy as another intensive producing animal.
So this is about the most technological that meat can get?
Not the most technological. In terms of technology, we talk about selection, natural selection, having achieved that.
So what is the science behind the Belgian Blues? There is a gene that regulates the growth of muscles in cattle. These cows have been selectively bred from animals that contain a copy of this gene which doesn't work. As a result, their muscles grow far larger than normal. To ensure that effective gene is passed on, sex for the Belgian Blues has been replaced by technology in the form of artificial insemination.
He is basically a sperm machine.
He is a sperm machine, absolutely.
It's very early in the morning for...
I understand.
The semen is now collected, it's in the artificial vagina, and from there we will process the semen in order to be able to process artificial insemination on the cow.
So precise is the technology involved, they can analyse the semen sperm by sperm to choose the ones they want.
As far as the athlete biological passport detecting gene doping, the endocrine panel can be used to measure the consequences of gene manipulation, protein changes, metabolite changes, and differences in genetic transcription previously measured. Now we're going to see a brief film.
As Liam grew, he continued to show signs of exceptional strength. His grandpa couldn't contain his pride. He told his friends about his grandson's muscle power. One of them was local doctor Erland Larson.
He was just, as all grandfathers do, doing a bit of bragging about his grandson, about how strong he was, and a lot of things about how you could see the muscles on his body and so forth. And I asked him how young the child was, and he said he was only 18 or 17 months, and it all sounded a little bit strange.
Dr. Larson's like, no way. So we had him come over, and it's like, wow, and he's scratching his head, and he's feeling Liam's, the skin on him, and he's like, there's no fat on him.
His grandfather had told me that he could, lift himself up with his arms, which is completely unheard of at that age. And so I tried lifting him up, and rather than leaving his arms fly up like a normal child would, he held on to them, and that very few well-trained athletes can do.
And then Dr. Larson's like, I think I've read about this.
Back in 2004, Dr. Larson had seen an article in a medical journal about an 8-year-old German boy who had super strength.
This child was the first human to date that had been diagnosed with a pure myostatin knockout deficiency.
Myostatin is a gene that limits muscle growth, beginning in the womb and continuing through life. Mutations in the myostatin gene can cause abnormal muscle growth, which is what happens in Belgian blue cattle. These super cows have sculpted muscular bodies. For them, this is a naturally occurring mutation. But myostatin was first discovered in a lab when a genetic engineer used the gene to create a new breed of rodent known as the mighty mouse.
We engineered a strain of mice who deleted this gene, and these mice are quite unusual in that they have 2 to 3 times the muscle mass of regular mice.
Dr. Larson wondered whether Liam's condition was also caused by a myostatin genetic defect.
A couple days later, he called us back and said, I think your son has something to do with this myostatin deficiency. And we're like, what?
The concern was that a defective gene could affect all of Liam's muscles, including the most crucial one, his heart.
Turning our attention to dietary supplements, which are plentiful in the marketplace. There's all sorts of different types of dietary supplements, including ones with promises to increase your muscle mass, energy enhancers, endurance increasers, weight loss, weight gain, workout recovery, pre-workout, and joint health. Are they effective? Are they safe? Are they pure? Is there accurate dosing? If you're an athlete in a sport that is subject to testing, are there any banned substances in these dietary supplements? In your ergogenic claims assignment, you're going to be taking a look at some of these dietary supplements, the promises they make, and the claims that they make. Some of them fall into the category of stimulants that can increase energy, endurance, reduce mental fatigue, and increase fat usage, such as amphetamines, caffeine, synephrine, ephedrine, which has now become illegal to use in dietary supplement products, but was used quite prevalently in dietary supplements to lose weight. Smart pills or brain steroids, such as Ritalin, Modafinil, Adderall. High school and college students using these to gain an edge for academic studies has been very, very popular. Energy drinks. You can't go to a store or to a gas station without passing through energy drinks such as Red Bull or Full Throttle or Monster or Rockstar to help give you that extra boost of energy or that caffeine kick to get you down the highway. They do contain stimulants. They can increase your heart rate and blood pressure. They are diuretics, so they can cause dehydration. It can cause a positive drug test if they have too much caffeine in them. If you're an athlete that's subject to sports testing, and again, if they're in combination with some of the cocktails that include alcohol and these energy drinks, they can contribute to problems in your liver and your heart. Sports nutrition. What is sports nutrition? It's the application of nutritional principles to enhance sports performance, to promote good health, promote adaptations to training, to recover quickly after each training session, and to perform optimally during competition. Again, what is an ergogenic aid? Ergogenic means that it has a means to increase potential for work output. It has performance-enhancing techniques and performance-enhancing substances. There are mechanical, psychological, physiological, pharmacological, and nutritional classes of ergogenic aids. As we see from the ergogenic classes, the hormonal agents, including anabolic steroids, HGH, androstenedione, DHEA, oral contraceptives, and clenbuterol. Physiological agents such as blood doping, EPO, or erythropoietin, bicarbonate, phosphate. Pharmacological drug agents including amphetamines, beta blockers, caffeine, diuretics, recreational drugs, pseudoephedrine, masking agents, and nutritional ergogenics, which include supplements, amino acids, carnitine, creatine, pyruvate, glycerol, herbals, alcohol, energy drinks, etc. Here we see various over-the-counter, found at your health food store or nutrition center, ergogenic substances. Chromium picolinate, as we see, yohimbine, ginseng, caffeine, ma wang, which is herbal ephedra, velvet deer antler spray, gamma oryzanol, starch, vanadrol sulfate, bee pollen, acai berry, and different types of hydroxycitric acids used for weight loss. There's so many more out there, and you should not have a problem finding an ergogenic supplement to study. So why are they so popular? Well, the use of drugs is illegal, and dietary supplements are popular. They're well marketed, and since they're considered to be natural, many many people consider them to be a safe alternative. Are nutritional ergogenics effective? Research suggests that a few are, but most are not, and supplements are found in each nutrient class, and you can see them in our chapter of our texts. Again, a product may not contain the substance as per the supplement facts label, and athletes may use the concept if 1 is good, then 10 is better, which is a dangerous thing to do with any drug, whether it's found naturally or as an herbal supplement or a medication. Some dietary supplements are banned in sports, such as anabolics, such as androstenedione, and stimulants, such as ephedrine. There can be contamination of these supplements with banned substances, which the athlete is responsible for knowing what's in their supplement that they're taking. You do need to be a smart consumer when it comes to using supplements. There's thousands of supplements marketed to enhance physical performance, and a lot of it goes into packaging and is no different than snake oil that was sold by peddlers hundreds of years ago. So nutritional quackery is misinformation, promotion of a worthless product or glitzy brochures, infomercials, and supplements are big business, into the billions and billions of dollars annually. Why is nutritional quackery so prevalent in athletics? It attempts to gain a competitive edge, and possible factors promoting quackery in sports are the eating behaviors of the star athletes, advice from coaches, misinformation in sports magazines and books, which are often full of advertisements with athletes endorsing these products. Some things you need to ask yourself when you do look at a product and you're going to put your money down on the table to buy it. Does it promise quick improvement in health or sports? Does it contain some magical ingredient or formula? Is it marketed by popular personalities or sports stars? Does it exaggerate a single truth about an ingredient? Does it question the integrity of the scientific or medical establishment? Does the person or magazine who recommended it also sell it? Are its claims too good to be true? So what types of research will provide valid information? First of all, there's epidemiological research, which is observational research. You study large populations and find relationships between the two variables for example, diet and heart disease. Epidemiological research helps scientists identify important relationships between diet and health and does not necessarily determine a cause and effect relationship. On the other hand, you also have experimental research, which is essential to establishing a cause and effect relationship. These are done with randomly controlled trials using double-blind studies and placebos, and there is a cause and effect. Some of the experimental research involves large groups or small group populations and conditions which should be random, a controlled or placebo situation, and a double-blind procedure, which is the gold standard with random clinical trials of large populations, making it more statistically valid. There can be a media exaggeration about these nutritional supplements. You have to look at the studies that are done. Are they from a peer-reviewed journal or a presentation at a conference, or is it just a magazine advertisement? What are the funding of the sources, and are the findings put in proper context? So you do want to look at high-quality research, including scientific books. Look at consumer organizations like .gov, .edu organizations. Avoid using caution with .com sites, which are typically commercial sites, that you're not going to get an objective look at the product. Scientific journals, be careful with popular magazines, and of course you do want to make sure that there's good endorsement from reliable organizations. So here are some interesting questions to consider. Athletes are responsible for whatever they consume, directly or indirectly. So contaminated supplements, many athletes claim that they did not know they were taking supplements that may have been contaminated, and use that as an excuse for testing positive for a banned substance. Supplements are not regulated by the Food and Drug Administration. If you're under a doctor's care, is it treating or cheating, so to speak? Research can be misleading. You want to let your physician know if you're taking supplements, and how much of them, the dosage, and how safe it is for the condition you have. Some of the supplements that are stimulants, you need to be careful if you have a cardiac condition. So here's some typical conversation with an NCAA student athlete regarding an inquiry on using an energy drink. So the student athlete would say, if I drink a Red Bull, will it cause me to test positive? The representative says Red Bull contains large amounts of caffeine, which is banned at at a certain amount. And the student athlete says, yeah, but will I test positive from drinking just one can? The NCAA cutoff for caffeine is greater than 15 micrograms per milliliter. So the student athlete said, so how much can I drink before I'll test positive? So as you can see here, the whole notion is, how much can I do without testing positive, rather than maybe looking at alternative means to taking a different supplement that might be more safe and may not risk testing positive for a banned substance. A very popular product is FRS Energy Drink. It's called a free radical scavenger. Contains juice and lots of vitamins in it. It's non-carbonated, and it has a similar flavonoid levels like eating an apple, and it's supposed to have antioxidant qualities to it. And of course it had the big endorsement of Lance Armstrong back in the day, when he had some credibility to his endorsements. Ma Wang is herbal ephedrine. It's found from a root plant known for stimulant properties. Ephedrine is a powerful central nervous system stimulant. Its structural similarities are similar to amphetamines. Methamphetamine was first synthesized in Japan trying to get ephedrine, and it was sold in the United States as Benzedrine for nasal congestion. When it's used with caffeine, it can enhance weight loss in obese subjects. It can cause, unfortunately though, in its outcomes, irregular and rapid heartbeat, increases in blood pressure and arterial constriction. Common complaints are agitation and nervousness when taking this. So some of the adverse effects that were found by the Food and Drug Administration included heart attack, stroke, insomnia, ischemia, and hemorrhagic stroke and death. Chromium picolinate. It's used to reduce body fat and speed up metabolism and weight management. It's found naturally in asparagus, mushrooms, prunes, and beer. Actually, it's safe and adequate dietary intake is about 50 to 200 micrograms, and deficiency can lead to glucose intolerance. Some of the outcomes is that it failed to produce any beneficial effects on body composition changes in men participating in weight training. Supplements used in conjunction with an aerobic program had no effect on reduction of body fat, and they have found that it may cause some chromosomal damage in cells. So again, this is a very popular, well-known over-the-counter supplement available. So we see herbs are popular with athletes, including supplements from the above plants. You see that we've got Arctic root, echinacea, caldrop, ginseng, and elderberry. One supplement that has come up, yohimbine bark from West African evergreen tree. It's used as a sexual aphrodisiac for functional impotence. It's stimulant. It is a stimulant. It's thought to block androgenetic receptors to improve blood flow. It can stimulate fatty acid release and spare muscle glycogen. As far as the outcome goes, no studies have demonstrated a true anabolic effect, and there are indeed some side effects depending upon the person who is taking them and what they might experience, including anxiety, rapid heart rate, insomnia, or sleeplessness. So with echinacea, it's an herbaceous flowering plant in the daisy family, and supplements suggested to have anti-tumor properties. It's also been used to help with illness. You'll see it in things like airborne or different types of medication to help fight a common cold. Here we see some of the changes observed in aerobic athletes supplemented with echinacea. You can take a look through these various categories. DHEA is a steroid precursor. It's available over the counter. It is banned by the World Anti-Doping Agency, the International Olympic Committee, and the National Basketball Association. It's produced in the adrenal glands, gonads, and the brain. O.J. Mayo, basketball player, and Olympic gold medalist LaShawn Merritt have tested positive for DHEA, and both indicated that they thought they were merely taking a safe and legal supplement since it is available over the counter. One treatment for healing is called platelet-enriched plasma therapy. It's blood plasma enriched with platelets. What they call autologous. It means it's taken from the person who is going to be having the treatment. They are the recipient of the platelets, so they have blood drawn, it's centrifuged and inserted back into the athlete again. So the World Anti-Doping Agency has removed intramuscular injections of PRP from its prohibitions, and there's lack of any current evidence concerning the use of these methods for performance enhancements. So now we'll take a look at ginseng, which is also used as a commonly used supplement both in and out of sports competition. The function and source is Panax ginseng, which contains saponins that can exert differing and opposite effects on the subject. It claims to improve energy, concentration, libido, weight loss, heart disease, and overall health, and reduces flu symptoms. Talk about some wide-ranging benefits. Recommended dose from dry ginseng root is 0.5 to 2 grams per day. And we can see here that some of the outcomes show that Siberian ginseng showed no effect on submaximal or maximal aerobic exercise performance in distance runners. And as a study of 44 commercial ginseng products sold in 11 countries found great variations in the concentrations of the active ingredients. Here we're taking a look at what ginseng and the effects it has on athletes in terms of changes observed in anaerobic athletes supplemented with ginseng, such as football, which the plays are very short in duration, and ginseng has been used to help with athletes in those types of quick burst of energy sports. We will be looking ahead to your ergogenic claims assignment, which is available on Blackboard assignments. You can look at the assignment guidelines as well as your syllabus for your due date. So let's review some of the topics that we went through tonight. So sports supplements are regulated by the Food and Drug Administration, and that is false. Ma Wang is herbal ephedrine. That is true. A technique of using autologous blood and re-injecting it into the same patient to help healing is called stacking, recycling, platelet-enriched plasma therapy, or infusion therapy. And the answer is platelet-enriched plasma therapy. We saw a brief film about that. Blank is an herbal supplement stimulant from an African tree bark whose purported benefits range from helping restore impotence to improving blood flow. And the answer is, from above, yohimbine. All of the following are true about DHEA except it's available by prescription, produced naturally in the adrenal glands, gonads, and brains. It's a steroid precursor, or it's banned by WADA. And the answer is available by prescription. No, you can go to your local store and purchase DHEA supplements right now. Epidemiological research is characterized by cause and effect relationships and variables that are conducted with random clinical trials. That is false. That's what experimental research is. It is the athlete's responsibility to know if they are taking a supplement that contains a banned substance, and that is true. Smart pills or drugs that are reported to improve mental acuity include all of the following except, so which one is not a smart pill? And that would be mescaline. So yes, all these other drugs up there are used for attention deficit hyperactive disorder that are often used in sports or even among those who want to maintain focus and concentration. Gene doping is difficult to detect method of altering an athlete's DNA to improve performance, such as increasing amino acid production or mitochondrial activity to build strength and endurance. And that is true. Experimental research is based upon anecdotal evidence that can be obtained through interviews and testimonials. That's false. Reminder to check your university email on a daily basis for any important announcements. Log on to the course Blackboard page daily to check for assignment guidelines, calendar your due dates, and check your updated grades in Blackboard Grade Center. Our Text, Drugs, and Sport 6th edition is available for 2-hour checkout at the Stanislaus State Library.